Good morning. Thank you all for coming this morning and joining us to learn about the group health plan for law firms offered by the State Bar of Wisconsin. My name is Annette Ashley, and I have the privilege of being the director of the professionalism and engagement team at the State Bar. And one of our goals is to listen to the needs of our law firms across the state of Wisconsin and to provide assistance and resources to address those kinds of needs. And one of the things that we have heard a lot about is just the kind of challenges that you face with providing healthcare coverage to your staff, your attorneys, and the challenges that come into connection with that. Now, I know that as you look around the room and you probably know that you have some things in common with your colleagues that are sitting here with you from across the state. I can almost assure you that one of the things you will have in common during the course of this year is that when your insurance, your health care coverage premium arrives in the mail or in your email inbox, it will increase. So what we are providing this morning is an opportunity for you to learn about this as a possible option to your own healthcare coverage with the post-pandemic medical utilization, the increase in drug and prescription costs, inflation, just what is happening with the medical profession, staff and employment situations. You are going to be experiencing most likely an increase in that premium cost to provide that benefit to your attorneys and staff. So this morning we have with us Christine Nadolski, and Christine is with the Professional Insurance Program out of Milwaukee. She is also here in the exhibit hall, so if you have questions and you want to talk with her further and learn more, you can always stop into the exhibit hall and visit with her as well. I would like to ask that we hold questions until the end of her presentation. She will take questions. We are recording this, so if you wait until you have the microphone to ask your question, that would be hugely beneficial for the purposes of recording this program. And the reason we're recording it is because we will replay it again on November 8th, and that is to catch anyone who wasn't able to be here today or to allow you an opportunity to maybe have someone from your staff back at your office listen to it as well to get more information and to learn more about it. I also want to mention one more thing. For additional information, this week in the Inside Track electronic newsletter that landed in your email inbox, there is another article that explains more information about the program, and I would encourage you to take a look at that when you have a moment as well. So without any further delay, I want to turn it over to Christine. Thank you, Christine.
Annette. Thank you so much. We love being a part of the State Bar Convention. Being able to provide you with the information to help with your budgets, to help with your needs of your firm. So today's presentation is Take Control of Health Insurance with the State Bar Health Group Plan for Law Firms. And as Annette said, I'm Christine Nadolski from Professional Insurance Program. Excuse me. And today we're actually going to go over the overview of the common types, common types and terms, plan designs, benefits of the plan, added value benefits at no cost to you, how do you get a quote for this plan, and some of the cost-saving examples that we have in other employee benefits. All right, so a couple common terms that we have is our plan types. There are two that we offer with the State Bar. The first one is a copay plan, or more of a traditional plan. These plans actually have a predetermined amount for thank you, Annette, for your primary care provider, for your specialist, and also for prescriptions. Another common plan that we have is a high deductible health plan, and a lot of times we refer to this as an HDHP plan because, you know, insurance people like to use as many acronyms as possible. As the name does suggest, it is exactly just that. It's a high deductible health plan. So all of your services will actually go to your deductible and any co-insurance that might be listed on the plan. So that would be your office visits, your lab tests, your prescriptions. The premiums do vary, and we find that sometimes the high deductible health plans will actually be a little bit more cost efficient because they do not have that first dollar benefit built right into that plan of actual doctor office copays or prescriptions. The good thing about these plans, that anything that is preventative and is coded as preventative and submitted will be covered at 100%. Does not matter if you have a high deductible health plan. You go in for your office visit, your annual office visit, and it's in network, you're not paying a dime for that. So that's a great benefit to have. Plus, you can have an HSA established with that and still get some more tax benefits from it. So it's a great way to kind of squirrel some money away, get a little bit of break on the premium, and have some tax benefits. Some of the terms that we throw around in the industry are deductible and co-insurance. To me, if I didn't know, they would be the same. I don't know what they are. So a deductible is actually how much you would pay for the health insurance before it starts to cover a larger portion of your bills. Deductibles will reset annually, so no matter when your plan renews, if it renews in May or June, your deductible will always reset January 1st. Your co-insurance is actually, we consider it like a cost sharing. So the company pays 80% after that deductible's been met of the next services until you're max out of pocket, and then you would pay 20%. So it gives some more responsibility on the insured, thus the premiums are less. So once your deductible is met, the co-insurance does go into place. Now, we did add a few plan designs within our group health insurance plans. So on the left side, you'll see all of our copay plans listed. They start at a moderate $750 deductible, and we added the $7,500 and the $9,450. Now, you might be thinking, what the heck? But remember, these plans will actually have your prescription copays built in, your primary care provider's copay built in, and your specialist copays built in. So if you go in for incidentals, that's when your deductible is going to come into play. Your high deductible health plan, or HDHP plan, that is HSA eligible, that one we do start at a $2,500 deductible. And as you can see, we have one that's a little bit more full in benefits. It has a 0% co-insurance. And then we also offer one with a 20% co-insurance to lower that cost. We go all the way up now in 2024 to an $8,050 deductible. When you're looking at the deductibles, these are all individual deductibles listed on the quotes and also in the literature. If you have a family, it will be 2 times that individual deductible. So keep that in mind when you're selecting a plan. Don't always think of cost. I know it's a big item on everybody's mind, but think about your needs and what your family needs are. So if you go with the $750, you're looking at 2 times that. If you can do it out of pocket, fantastic, but I would say definitely think about the situation, the family situation as well, and especially of your employees. Some of the plan benefits that we have, oh, hang on. There we go. Some of the plan benefits that we have that other carriers may not have, you can elect up to 4 plans with one carrier as long as you have an employee in that plan. So it's a great way to customize the coverage for your firm, for your employees. Maybe you have a receptionist that has a couple of kids and she can't really afford a $2,000 or $5,000 if it's family deductible on an HSA plan. So maybe she would like more of a copay plan. So when she goes in for those incidentals, because you know kids, they're always doing something, and it would be a $25 copay for her. Employer contribution, this is one reason why I think firms and employers do not offer coverage, because with an Affordable Care Act plan, they have to pay at least 50% of that individual premium. Now, if you don't have that in your budget, pre-planned, and you're trying to retain great employees and you're trying to bring in new talent, it's kind of hard. So we eliminated that need for any employer contribution. Although we do recommend 50% because we want it to be a benefit for your employees, an employer can contribute from 0 to 100% of the premium, totally up to the employer. So it gives you, the firm's owners and attorneys, it gives you guys a little bit more freedom and a little bit more pull and say, okay, yes, I can offer a plan, but I can offer it this way. Another great benefit that we have is 26 hours for full time. We know that there's a lot of employees that only work over 25, but not quite 30 to get those benefits. So we in WPS decided, let's bring that down to 26 to be able to offer individuals who do not work that full 30 coverage. If your handbook says 30 or more, we will abide by that because we are not going to overstep your office by any means. We have a lot of customer resources online on WPS once you do enroll as a client or a insured. There's access to health information, wellness information. You can look up your explanation of benefits, see exactly how everything was charged. If somebody is requiring an explanation of benefits for something, you can print that off. They have an extensive library of wellness information, tips, and it's amazing. I have not been entirely through all of it yet, and I've been here for 18 years. So, just because there's so much. We also have a prescription drug coverage that has a $0 copay on select preventative drugs. This does help to manage chronic conditions more effectively. So we have the list that includes treatment for asthma, depression, diabetes, high cholesterol, high blood pressure. And it's not just the generics. There are also brand names on that list. So it's kind of nice to go to the pharmacy or get your mail order delivered to you and, oh, all right, well, that's fantastic. So I do have a list of that as well. If you are interested, let me know, and I will most definitely get that over to you guys. As I mentioned, preventative services will be covered at 100% by WPS as long as you're in network. That includes routine immunizations, routine medical exams, including routine diagnostic services, baby care, mammograms, and preventative screenings, including your colonoscopy. Now, a lot of times people think, it's a little early to talk about colonoscopies, don't you think? But a lot of times people think, oh, I have my routine colonoscopy, I'm gonna go in. If they find anything in that colonoscopy testing, it will then be diagnostic. So if it's your first one, it'll be preventative. Your next one will be diagnostic, and it will go towards your deductible. All right. And those who have travel plans outside of Wisconsin, kids in another state going to school, or family in another state that you want to visit, rest assured you will have coverage outside of Wisconsin through the First Health Network wrap. This includes all 49 states of Wisconsin. So those who talk about, is Mayo in Minnesota covered? Absolutely it is. As long as your provider is First Health and you're outside of the Wisconsin border, you will have in-network coverage. I know it's real hard up in New York, and I had a client who had a child going to school up there and was able to find coverage or providers in her area email it to her and her daughter so she could get the care that she needed. So that's an extremely strong network. Some of the no-cost added values that we have also includes telehealth medicine from Teladoc. I cannot tell you how important this is, because when you are sick and you are in bed and you cannot get out, and you obviously don't want to go to the doctor's office where everybody else is sick, dial up your Teladoc. They have an app, they have a phone number, you can talk to them, you can FaceTime with them, you can send them a message. I was at my husband's summer party picnic for his company, and something just wasn't right. I kind of excused myself and made a call, and within 5 minutes, the gentleman called me back, board-certified physician, and I had a prescription waiting for me at Walgreens when I was going home. So obviously he said, because of your age, and then I was like, hey, wait a minute. But anyway, another item that was built in the last couple of years is mental health. WPS realizes mental health is an issue. It is a statewide, national issue. We are finding more people, unfortunately, unaliving themselves nowadays because they didn't get the mental health benefits that they needed. I cannot stress enough, if you are feeling anxious, stress, depression, just not feeling like yourself, anything, use that Teladoc with mental health. It's there for you. It's a copay. So even if you're on a high deductible health plan, it's still going to be a copay. So it doesn't have to have your deductible met before those benefits are payable. Dermatology, another one that they added, for people with acne, eczema, skin infections, you take a picture, send it to them, show them, depending on where it is, and they can try to diagnose that and try to help you and get you in for other appointments to help alleviate the issue. We also have an iMed Vision discount program that I use frequently, obviously. And includes LensCrafters, Pearl Vision, Target Optical, and many more. I actually go to Wisconsin Vision, and I have no issues with that. Provides discounts for routine eye exams, glasses, and laser vision correction. Now, this is not a vision insurance, it is a vision discount. So if normally Wisconsin Vision says, okay, let's see what discount is going to be better, and we'll offer you that. So sometimes it's WPS or iMed, sometimes it's them. So I always take my sheet with me and say, this is what I have, and they go through the spiel with me. We have a hearing care solutions included, gives you a comprehensive hearing exam. If you do wear hearing aids, there's a hearing aid fitting, discounted prices on hearing aids from 9 different manufacturers, and a 3-year warranty, and a 3-year supply of batteries for non-rechargeable devices. My brother-in-law has a hearing aid, and the dog ate it, so he wishes he had this. Darn thing. They also have a program for, there we go, pulmonary care program to manage asthma and COPD. And if you do suffer for any of this, you know how important it is to know where your inhaler is and proper use of it. So it does include a sensor for the inhaler and also a mobile app. It can verify your proper use of your inhaler, that you're not taking too much or taking too little, track your usage, identify your trends, and provide tips for better breathing. Encourages compliance reminders to take your medication, and then also provides your monthly and weekly summaries that you can actually provide your treating physician. And if you lose it, it does have a locator on it as well. There is a diabetes care program called WellDoc. This is a personalized management care for diabetes. Again, it includes a mobile app. So it acts as your personal diabetes coach, connects with fitness tracker and blood glucose meters, provides individual and real-time feedback and suggestions, encourage compliance with medication reminders, and connects the data for food, weight, and activity, blood pressure, and sleep, and more. Well, that's like having a little physician right there for you. And another product that we have that's added in is the tobacco cessation assistance. So if you do have members that are 18 years or older, this program will provide up to 180 days assistance annually. It includes your tobacco cessation, which does require a office visit, one nicotine replacement over the counter, such as Nicorette, inhaler, nasal spray, and then one non-nicotine replacement, most popular, that's Chantix or Nicorol. All right. Oops, did not go. There we go. We do have, for the individuals who love fitness and want to keep in shape and keep their bodies Active and Fit Direct program has membership discounts for over 12,000 standard centers and 5,200 premium centers. It's a $28 a month fee with plus the $28 enrollment fee. And if you are at a standard center and you want to go to a premium center, you do have the availability to do so, and anything that you've tracked will transfer over to that participating facility. Kind of nice that you don't have to do it all over again. So how do we get quotes for this program? We do have a census form on our website. If you contact marketing on our website, there will be a link in there as well. Fill out the census form, send it back. We will provide you with preliminary rates, because these are underwritten programs, because it is underneath the umbrella of the state bar. Fill out the applications. We send out the applications and any other needed information to underwriting with your preliminary rates. They will go ahead and review everything, send us back those final rates, and you can get a group plan at any time. I know it's pushed at the fourth quarter for open enrollment, but if you are on a plan and you say, you know what, Chris, I'm on this plan, and the darn thing went up, how much percent, and it's only June, contact me. I will take care of that. I will quote you out. I will get underwriting rates. There's no obligation to go with it, but let us show you what we have to offer you. And surprisingly, sometimes they're less than the Affordable Care Act rates, especially with the increases. We've been hearing a lot from the Pfizer Family Association. I can't remember if that's the right name for it, but they have been numerous reports that prices are increasing. Staff at medical facilities are low. Prescription premiums are high. The cost, why is there good RX? Because the manufacturers are raising those costs every time they come up with a new prescription. And unfortunately, sometimes we have to take these because they're life or death. And, we really want to establish that group plan for you. So let us show you what we can do for you. All right, some of the cost-saving examples. The first one I have here, a group was looking for new health insurance for 5 employees. They were currently paying a little over $69,000 annually, and the renewal was going up to over $80,000. Although the association health plan, through the association health plan, they were able to get a copay plan with a $2,500 deductible, which is pretty good, for a little over $5,500 annually. So who doesn't want to save $25,000 a year? All right, the next one we have is an office was looking to save some money with their health insurance for 3 employees. It was going up to a little over $22,000 annually from $18,000. They were able to get, now again, a $2,500 high deductible health plan with an annual premium of a little over $18,000. So they were even under what they currently were paying before the renewal. you know, I would like to, save $3,600. Any bit helps nowadays. And the last example I have is an office with 3 employees had health insurance in place, and they were paying $46,000 annually. Upon the renewal, the premium was increasing to almost $49,000. They reached out to us. We went through the association group plan quoting process, and they were able to get a $5,000 deductible copay plan with an annual premium of $36,218. That's an annual savings of over $12,000. So it really does pay to investigate it and to look at it at any point in time. So what are employee benefits? For employers providing a comprehensive employee benefit package, it always has been the key to hiring and retaining exceptional employees. Unfortunately, doing so has become increasingly challenging, as you know. We can assist you with creating a program for your office. We have dental, we have vision, we have disability, individual and group. We have life insurance and also flexible spending accounts that are available through our office. All right. Well, any questions that we do have? Oh, absolutely.
Oh, sure. In those examples, you indicated 3 employees. What happens with family plans?
Very good question, and we do have a lot of individuals who call us who are a family firm. Now, we do have to have at least 2 individuals, non-family related, that are full-time. So if you have somebody who's working 26 hours, we can consider them full-time. If they already have coverage and they waive, we can still insure you and your family. So you can do a group of 1 as long as you have 1 other full-time employee waiving. But keep in mind, it is a true group product. So what happens is any people who waived coverage and voluntarily lost their coverage, they call it a special enrollment period, they would be able to come onto your coverage, or any new employees that satisfy their probationary period would be able to come onto the plan if they needed to as well. And again, that's where you have the leverage of saying the employer contribution, what are we going to contribute to the individual's premium? Totally up to you guys. And it can be changed at any time, so that's not a problem.
So when you said in the one example, 3 employees, $5,000 deductible, the premiums were $36,000. Is that the cost to the employer, or is that
That would be the total cost of the plan annually. So
be
if,
split between the employees and the employer?
however you decide to do contributions. So if the employer contributions are 0, then that would all be the insured's responsibility, so all the employee's responsibility to pay. If you do 50% of the single employee, then, and assuming that they would be all single employees for the sake of this, then you would cut that in half and say, okay, the employee's portion is half of the $35,000. The employer's portion would be the other half.
That was the answer to my question regarding is that the full premium. As far as the organization, is it a for-profit entity or nonprofit?
We are actually tied to, professional insurance programs is tied to the Wisconsin Dental Association. The Wisconsin Dental Association is nonprofit. We are the for-profit entity. WPS is nonprofit.
Okay, and how many members do you currently have?
We currently have, I'm not sure on the exact total, because I did not pull that up, but I know that it's like around 150 members and growing. It's more than that? Okay. I get the associations mixed up, because we also do the Wisconsin Dental Association and the Wisconsin Funeral Directors Association, their own. Okay. Thank you, Annette.
Let me bring you the microphone, I'm sorry.
What's the difference between that $2,500 high deductible and the $5,000 copay? What is that? Like, what do those terms mean?
Not a problem. So the $2,500 deductible really is the deductible within that either copay plan or the high deductible health plan. Let me go back here and see if I can bring up that section with the plans. Oh boy. And we'll be able to show you how that is. Sure, it's in the beginning. Oop, oop. There we go. So where I'm saying $2,500 deductible, the copay plans have a $750, $1,500, $2,500 deductible. So the $2,500 copay should have been, or should have been $2,500 deductible copay plan. And then we also have the different deductibles on the high deductible health plan as well, from $2,500 to the $8,050. Okay, sorry about that. It's like, perfect.
Yeah, you said this is it's a group health plan, right?
Correct.
So does that mean this is subject to like ERISA and COBRA and HIPAA? Do I have to do all that, or do you guys do that?
That's a great question. So if your firm is over 20 employees, we would initiate the COBRA through WPS. If it's under 20, then we initiate the continuation. Correct. Correct. So with HIPAA, I know we do, every year we send out all of the compliance emails with, is your Medicare, the Medicare Part D compliance emails. We always send out reminders. WPS will also send an email out as well, indicating if your plan is compliant or non-compliant, or credible, I should say, non-credible or credible, with the Part D. HIPAA, we don't facilitate that, but we do have a third-party administrator that we can provide all of the compliant components, ERISA, COBRA, the flexible spending accounts. I'm just trying to think of all of the programs that they do. But they just started doing the ERISA for us as well, so. That's Diversified Benefits Services in Heartland.
In terms of the network, you mentioned the network before. Are there any major state health plan groups or health providers that are not covered in the network that you're aware of?
No, and that's a great question too. Statewide network encompasses about 95 of all the providers within Wisconsin. They have Aurora, Freighter, Ascension, Pro Health, Freighter, Children's. So they do encompass all of the major providers. There may be a provider or two that you'd always want to check on the website to make sure that the provider's in network. There may be one or two smaller shops out there that might not accept the insurance. A lot of times they don't accept any type of insurance either. But I have not had an issue with people going out of network within this provider network. So absolutely, but always check.
I see the listing for the HSA qualified high deductible health plan. Do you offer an HSA as well?
We do offer it through Diversified Benefit Solutions.
Great. And do your HSA and FSA programs have reimbursements by way of a card as opposed to just by a reimbursement form?
Yes, actually they do. We use Diversified Benefits for our flexible spending account, and every year they will issue us a new card, which they actually issue us 2 cards just in case. So they are very good with issuing that and getting everything there. Perfect with answering any questions that might come up as well. They're a fantastic reference for us and resource. You're
And-
absolutely welcome.
And just to throw out another group, we have an arrangement with Task, which also is a handles these kinds of flex benefit, HSA spending accounts as well at a discounted price to all of our members, and that information is available on our website, our State Bar website. Are there any other questions? I don't see any hands right at the moment.
Not at the moment. Let's get back to the contact information. You can always find us on our website here. Oh, there we go. info@profinsprog.com, our toll-free number, and of course, www.insuranceformembers.com. We do have all the associations listed and all the products available to you. We also have webinars that you may not have seen, and you can register for those on-demand webinars. We just ask for registration so our marketing team knows what type of traffic she's seeing, and it's a wealth of information. So thank you all for joining me. I know I'm kind of long-winded, and I'm glad y'all had coffee and breakfast, hopefully, and have a wonderful rest of the seminar. Thank you again.